This is Dr. Mark Castellaw. Welcome back to Health Matters. Our program today is about diabetes, and our first guest is Mr. Jim Boswell. Mr. Boswell is the CEO of Baptist Medical Group, or BMG as we like to call it. And the first question is, well, what does Mr. Boswell have to do with diabetes? Well, just recently, BMG, through the direction of Mr. Boswell, has partnered with the Endocrine Clinic as part of the outreach to diabetic patients in the Mid-South. Welcome, Mr. Boswell.
Well, thank you, Dr. Castellaw.
Well, tell us about BMG. What's going on with that, and what is, we see BMG everywhere. What does that mean?
We are so excited about BMG. The BMG, Baptist Medical Group, is 3 years young. We started in 2009. We're a group of physicians that came together around common principles of patient care and physician-led, and we have grown to 550 physicians in those 3 years. And we are so blessed to be able to have the Endocrine Clinic recently join us.
Now, how many primary care doctors are part of BMG?
Primary care physicians are close to 200 across the three-state area. And BMG's expanded into Tennessee and in Arkansas.
In Arkansas.
Absolutely. We have physicians. We practice 43 specialties, and we cover all 3 states where Baptist has hospitals.
Now, that's the primary care. What about the specialists? What are some of the typical specialists that are part of BMG?
Well, we would have cardiology with Stern Cardiology, and we would have internal medicine and pulmonary and critical pulmonary, as well as oncology, as well as several different pediatrics we would have as well. Now,
to the average patient, what is the benefit to the patient to be involved with BMG? I mean, why would I be a patient that would come to a BMG facility?
Well, in so many communities around the country, and as well as in Memphis, healthcare is very fragmented. We have different specialties in different offices, and inside BMG, we are all come together under one roof. Baptist Medical Group. We share a common medical record. The doctors are all partners. So the coordination, for a patient, the coordination and the communication of care leads to better care.
Well, that's being a primary care physician and being part of BMG, which we're very proud of. That has been one of the major benefits that we've seen in our group, the medical group, is that being able to access these other specialists so much easier than we would if we weren't a part of a group like BMG. But what do you see as far as the future of BMG with doctors and acquisitions?
Well, acquisition has continued, and each year we bring on 15 or so different groups. So I don't expect that that'll change in the near future. I do see that as an organization, we are streamlining our processes. We are all come together around a common medical record, as I mentioned, and as healthcare evolves. And more quality focused in terms of and what we call value focused versus volume focused. Our organization and our board and our quality committee is intently focused on driving best practices around all of our organization.
Being an expert as you are in healthcare, everyone is so anxious. The patients are anxious about their health care now with all the changes with the laws, the federal laws and changes. What advice can you give to patients about their health care and seeking insurance products?
Well, first I would tell you, find a really good primary care physician. And as far as insurance products, there's lots of choices there. Of course, we have in the government under the new Obamacare, we do have a lot of choices with the exchange. My advice is find a product that works for you. Find a product that allows your physician and is in network for your physician and your specialist that you may use, as well as your hospital or your health system. Make sure that you can access all the services that you need. But there are lots of choices there, and we at Baptist Medical Group can help you if you need it.
Now at BMG, whether if we have a particular specialist that's a part of BMG or not, we don't restrict patients where they go. We can help them find a specialist that may not be a part of BMG.
That's correct. We certainly have access to all the specialties, and if it's not in BMG, we can get you into that specialty, as you said. And Memphis is blessed to have pretty much every specialty that is available that you might need as a patient.
Now, is the Endocrine Clinic the first partnered group that specializes in diabetes?
Absolutely. In the Tennessee market, we do have endocrinology in Arkansas, but the size and the scope of service that the Endocrine Clinic provides is absolutely a sort of a charter for us, and they have a long history of providing excellence in endocrinology care and diabetes care. So we're just really blessed to have them.
Well, thank you for being with us today, Mr. Boswell. And this is Dr. Mark Castellaw with Health Matters. Stay tuned in because we have a lot more information about diabetes and you'll want to know about it.